Hi, this is Dr. Pharidah Rajan Ibrahim Omasundi. So today I'm going to discuss liver cirrhosis, looking at the causes, the symptoms, the treatment, and prevention. So if you haven't liked, please do like, share, and subscribe. So what is liver cirrhosis? So liver cirrhosis is a late-stage chronic liver disease that is characterized by irreversible fibrosis and scarring of the liver tissue, leading to distortion of the liver architecture and impairment of liver function. So let's look at the pathophysiology first. So you have first initial liver injury, where there is chronic inflammation and hepatocyte injury stimulating fibrogenesis. Then you have fibrosis formation, where there is activation of hepatic stellate cells leading to excess collagen deposition. Then you have nodular regeneration, where the liver attempts to regenerate but forms abnormal regenerative nodules. Then you have vascular remodeling, where there is distortion of vascular architecture, which will lead to portal hypertension. So what then are the causes of liver cirrhosis? There are various causes, and these include first, chronic viral hepatitis, where there is things such as hepatitis B and C, which are the most common causes. And then you can also have alcoholic liver disease, where there is excessive and prolonged alcohol consumption, which will damage liver cells. Then you can have NAFLD, which is non-alcoholic fatty liver disease, or non-alcoholic steatohepatitis, where there is often associated obesity, diabetes, and metabolic syndrome causing liver cirrhosis. You can also have autoimmune hepatitis, where the immune system attacks liver cells. You can have genetic and metabolic disorders, where there is things such as the Wilson's disease or iron overload, which we call hemochromatosis, causing liver cirrhosis. We can also have biliary diseases. Drugs and toxins also can predispose. You can also have, in rare cases, infections such as schistosomiasis also causing liver cirrhosis. So what's the clinical picture? What are the clinical features or the symptoms? So let me break it down. I'll start with the early symptoms, where there is compensated cirrhosis, and then I'll also look at the late symptoms, where there is decompensated cirrhosis. So for the early symptoms, you can have things such as fatigue, anorexia, weight loss, weakness, and right upper quadrant discomfort. And then for the late symptoms, this is where you'll find symptoms such as jaundice, ascites, where there is abnormal fluid accumulation. You can have things such as edema, hepatic encephalopathy, where there is confusion or coma. You can also have variceal bleeding due to portal hypertension. You can have muscle wasting. You can also have spiral angiomas, Palmar erythema, or gynecomastia, when there is hormonal imbalance. So those are the symptoms. And then coming to the complications. So complications will include things such as portal hypertension, which will lead to splenomegaly, ascites or varices. You can also have variceal bleeding, variceal hemorrhage, which is life-threatening bleeding from esophageal or gastric varices. You can have ascites. You can have hepatic encephalopathy due to ammonia accumulation. You can have hepatorenal syndrome because there is functional renal failure. You can also have hepatocellular carcinoma, where there is increased risk with because of increased risk with cirrhosis. So what's the diagnostic approach? So you can do laboratory tests, you can do imaging, you can do biopsy or endoscopy. So for the laboratory tests, you can look at the LFTs. So you can have elevated ALT, AST, you can have low albumin, prolonged PT or so platelets also are often low, and bilirubin will be elevated, and serum ammonia will be elevated in encephalopathy. So you can also do imaging, where there is ultrasound, where you check for the liver size, the nodularity, ascites or splenomegaly. You can also do a CT or MRI for more detailed imaging. Yeah, you can also do liver biopsy, which will confirm cirrhosis and determines the etiology. If unclear, you can do an endoscopy to detect esophageal varices. So coming to the management, there's general measures where you treat underlying causes. You can do carry out lifestyle changes where you have to stop alcohol, and also nutritional support, high protein diet. And then you also manage complications. If there is ascites, you encourage salt restriction. You can also do for varices, you can do a non-selective beta blockers. You can give drugs, antibiotics for bleeding prophylaxis, endoscopic varicose ligation in case of bleeding. Just the definitive management also can include liver transplantation in cases of end-stage cirrhosis. And for prevention, mostly there's vaccination for hepatitis B, because we know that hepatitis B is also one of the causes. You can practice safe practices to prevent hepatitis transmission, alcohol moderation or cessation. You can encourage regular monitoring for individuals at high risk. You can also do early treatment of chronic liver diseases. So that's just a brief discussion on liver cirrhosis. I hope to see you in the next video. Follow for more. Thank you.